think the important thing that we bring to the mix is that we really focus on all of the audiences that care about childcare.
That peace of mind of having quality care is so important. Because we were able to go to work and not worry about the care that our children were receiving.
I think the parents are definitely more comfortable and feel more confident with me as a provider, bringing their children into my care.
I think that through the years and through the R&R system, the communities have grown.
You ready to go? Let's go see Auntie Hannah.
When someone has a job and they need to have the child care so they can be at that job, they can call into Child Care Resource and Referral, and the referral counselor will talk to them about tell me more about your child. Would they do better in a small group setting? Are you thinking about a family child care place? Are you thinking about center care? Listening for what that parent is interested in having. And I particularly think Child Care Resource and Referral has been helpful for first-time parents.
My son is my first child, and so I didn't really have a lot of experience in finding a daycare and knowing what I should be looking for with respect to a daycare.
Because of the work and the information that I received from CCR&R, I was able to step in and ensure the quality care for my kids.
And we, in the Child Care Resource and Referral work, have always put a high value on quality care. We don't just want warehousing of children, we want educational and social emotional environments that are going to really stimulate and help that child grow.
Not only is it been important to me to have CCR&R available, but what's really important too is they provide that ongoing training for child care providers.
We always want to meet providers where they are. We don't want to start by ever thinking that providers aren't already. In many cases, they're already providing what any of us would think of as quality care.
I think people are skeptical that somebody's going to come into your house and nitpick and point out all the things that you're doing wrong. My experience has been the opposite of that. The people that I have worked with, they have shown me the things that I have done right, helped me realize where I could improve.
Whatever we can do to enhance the quality of those providers and support them in their professional development, that's what's going to impact that community.
I think the need for quality child care in communities of color or in communities where there's high rates of poverty, I think that it's even more important to have that there. There's so much more education, there's so much more awareness on what is right for the child, what's healthy for the child, and what their needs are to empower them, to strengthen them, to just give them that first healthy start.
I think the parents are looking for the providers to help them get those kids ready for school. That's where I needed the help. I wasn't sure what to do. I wasn't sure if I was doing the right things, the wrong things, or how to approach that type of learning.
The core of what we've done has always been around how can providers do better by kids every day. But I think this new attention to school readiness and really helping providers understand that the children learn regardless of what setting they're in and whether they're learning things that will promote school readiness or things that will hurt their ultimate development, they are learning.
I know that I will continue professional development because the children in my care need that. Every child that comes into my care needs something different, and I need to be aware of those needs, and I need to continue with the development to meet the needs of the children.
To look at my kids now that are in 6th grade and 3rd grade, having that quality childcare back when they were young, I know that my kids are off to a great start. They're doing well in school, they're well adjusted.
What I see with R&Rs that is a huge challenge that they have often had to face and step up to is how many potential constituencies they have. There's the natural ones that we think about. There's the parents of children who are seeking childcare. There are the providers, both family and center, who need training. But then there are the local communities and the counties that license care. so we can get more kids into care because the county has a responsibility for getting people into work.
We have a wealth of data because of what we do and how we're structured about what is going on in the child care community, what are providers experiencing, what are parents asking for, what parents aren't finding. Where we try to connect with the policy advocacy world is to, first of all, bring that data in, be that voice for both parents and providers who often can't get at those advocacy tables. We can, and make sure that policymakers are educated about this issue. It isn't just babysitting. It's a critical function for our workforce, both current workforce because parents need to get to work, future workforce because these are the kids who will be in the workforce and their early development matters.
And what I have seen with the R&Rs I've worked with over the years is they try very hard and do a really good job of balancing all of those constituencies and realizing that those are all partnerships that benefit the children and the families in the long run.
We've come a long way. We have a long way to go, but through the involvement of the community, all communities, communities of color, the metro, the suburban, the rural Minnesota, we all have a role to play in the development of the care of our children.
The thread that I've always seen here is that we match resources with needs. And the challenge is in an environment of limited resources, we have to be really attuned to how do we best meet the needs of today and the future.
If we can continue to work and grow with parents and with the evolving child care system, we'll continue to position ourselves to be the go-to people for that information.
I'm really excited to introduce the name Child Care Aware of Minnesota. I think it does a beautiful job of capturing what we've really always been doing and certainly where we're headed.